Hello, everyone. Welcome to the COVID-19 Health and Medical's podcast series. I'm Dr. Til Jolly, Chief Medical Officer of Aveshka, and I'm proud to be serving as Chair of the Medical Advisory Board for the Innovation Institute for Fan Experience. Our organizations are focused on bringing the best information available related to COVID-19 for the sports and entertainment industry so that we can all learn how to work, play, and spectate safely and effectively in our new environment. Our weekly podcasts bring you up-to-the-minute information on everything from youth mental health to vaccines to testing and all the information sports and entertainment leaders need to know as they navigate our new normal, as we call it. This podcast series will be aimed at the sports and entertainment industry through COVID-19 and beyond as we face multiple health and safety threats in an evolving world. Importantly, this particular podcast is taped in the fourth week of March of 2021. I say that because COVID-19 is changing very quickly, and the information and the facts change very quickly, and we will continue to update this series on an as-needed basis. Today's episode is going to focus on some important issues related to performance and sports events so that we can all learn from the experts how to undertake events at all levels for athletes as we bring them together to compete. Today's guest is Dr. T.K. Miller. Dr. Miller is Vice Chair of Orthopaedic Surgery and Chief of the Section of Sports Medicine at the Virginia Tech Carilion School of Medicine. And he is also, importantly, the Chair of the Ironman Group Global Medical Advisory Board. He has an extensive experience at all levels of performance sports as far as advising athletes and event organizers on how to carry out events to their fullest extent. He's going to be sharing his insights with us today, and welcome, Dr. Miller.
I appreciate the opportunity. It's a pleasure to be with you on this podcast.
Thanks very much. And we're going to touch on a number of COVID-19 issues as we go through this. But first, can you tell us a little bit about the Ironman competitions for those of us who aren't quite up to that level of athleticism, and how the medical events are managed within Ironman?
So traditionally, we have a team that's dedicated to each event. The race in Hawaii has a group that has come out there, some of them for the past 30 plus years. And it's divided by people with experience and people who are new to coverage of events. And in addition to that, the Ironman group has a fairly comprehensive playbook on how to provide coverage at events from the shortest up to the full Ironman distance of events. Now, obviously with COVID, that has changed. We've had to adapt. And as events are going live, we're building off of our traditional models, but taking into account the changes that are necessary to cover the new medical challenges that we're seeing.
So you touched on sort of what's gone on in the past year, and I'm sure these are complex events. They involve performance athletes, spectators, and the logistics around those events, which people don't really see, but I'm certain are quite complex. But for performance athletes, and this is kind of a broad question, but what has the year been like? We're over a year into the pandemic now, and they face performance issues, health threats, and other. What's it been like for those athletes?
So I think part of it, if you look at this, their norm has been completely disrupted. Their training protocols, programs, who they train with, where they train. There's certainly been a large jump to virtual components of this. And I think that has been able to tide them over to a degree. If you look in the perfect example, it was the tour in France this year, where they had safety protocols in place and they were able to bring the event back on board. I think athletes have been able to carry over a fitness level, but it's a different environment for them. It's coming back to the concerns about group participation, what's going on during their competition, how do they interact immediately afterwards? That is a different environment for them. But I think the flip side of that is these are people that are professionals. They have figured out how to continue their ability to be prepared to compete once given the opportunity in the field to do it.
So we heard and continue to hear a little bit, but heard early on and had concerns about some specific medical problems that high-level athletes, whether they
Yes.
be triathlon participants or um, high-level basketball players, football players, and others, and some of the medical consequences of COVID, to include particularly heart issues and other things. What have we learned about that in those athletes, and what do they face now?
It's interesting that the cardiac concerns, which were extrapolated from some early data, were really pretty frightening. And it resulted in protocols that have been backed off a bit since then. So if you look at early on, it was, you know, lab-based studies, stress tests, cardiac imaging, and it was an across the board because it was any elite athlete who had COVID symptoms or even tested positive was felt to be at risk. As the numbers evolved and as a larger and larger group had been assessed, that has been backed off on actually quite a bit. And there have been sequential reports and best practices that have released, and another one due to come out shortly. That said, there is still a subgroup that is of concern. The athletes who have severe symptoms, the athletes who have had prolonged symptoms, even if mild, still need to be looked at differently than the asymptomatic athlete. And those are individuals where an extensive assessment and ancillary studies are still indicated. And it's something that shouldn't be taken lightly because we have a large group of athletes who have recovered who may not have access to, and I'll use professional or collegiate level sports where they are monitored on a regular basis and have ready access to that. There are a number who don't quite have that, need to be aware that recovery does not mean unrestricted return to activities.
So you bring up a number of other leagues and sports involved. We've heard about things from professional football with very high success at getting a football season in, but also with tremendous resources put into that, from testing and screening and otherwise, to the NBA with a bubble, to the NHL with a bubble, college sports, which had variable success. And we have March Madness going on right now with games that at least one of which was disrupted, and conference tournaments that had problems. But if you're an event organizer in Ironman or other related sports, perhaps down the range of skill levels, what do your athletes need to know, and how do they need to kind of manage themselves in the current COVID situation?
For the athletes, I think they need to be aware in of two components. Number one, for those athletes who have been COVID positive, particularly those who have been symptomatic, this is not a magic switch at 10 days. You're permitted to return to activities from an infection control standpoint. That does not equate to safe return to activities. And there does need to be considered a graduated return to activities based on how symptomatic somebody was and how long they were symptomatic. For those who are not symptomatic, there are ways to optimize risk mitigation so that you can come in and compete. And they're really the things that have been said all along. You reduce your contacts, you reduce your exposure. There is a reasonable time frame to do that. It's surprisingly almost identical to how do we manage elective surgical patients. We use almost identical protocols. And with that, you can get an athlete group or an individual athlete down to expecting that they can safely participate because they've avoided the risks that may impact them on or immediately associated with their participation. And it's distancing, it's contact, it's masking. It sounds like a repeat of everything that's been said, but it is remarkably effective and works, and it's the best way to take care of them. And then I'll throw in the last one, as things are evolving, the consideration of vaccination and how much that puts them into a lower risk category.
Right. And we're certainly going to touch on vaccination a little bit, and the messaging around that. So I'll ask you to speculate a little bit, and with the caveat that I don't think anybody expects anyone to have a crystal ball or know exactly what's going to happen in any way. But event organizers, whether they be at the Ironman level or a community run, a community 10K, have to think about in the coming months, how are they going to manage logistics? How are they going to manage a staff that need to be involved in this? How do we advise them? Just from an event organization standpoint, these are largely outdoor events, so presumably safer than indoor events.
Mm-hmm.
But obviously, mixing of crowds is an issue. How do we advise them to manage themselves as people want to get out and be more active?
The first thing I think has been recognized is everything's going to take more space. If you want to mitigate risk, you spread people out. So it's spacing, it's reducing touch points, it's controlling flow and contact. So a lot of what was traditionally done, and I'll just use a race check-in as an example. You show up when you wanted to, you never knew what the crowd was going to be. There are events, and I'll use Ironman as an example, who have changed that entire model of scheduled check-in, spread the times out much longer, protective barriers for both the volunteers and the participants, education on pre-screening, and education on risk mitigation. So athletes showing up for events have already done some of the things to lower their and the volunteer group's risk. Events are taking place in a different manner. You can look at what used to be massive events that are struggling on how to present their field safely. Some smaller events, and there's one that I've just been asked about, fortunately have access for a number of different roadways to the same starting point. So they're doing wave starts, they're spreading their athletes out, so they're spread from start to finish. Now, the downside of that is events take longer. All of a sudden, your volunteer staff are out there longer than they've ever been before, because what was everybody start at 7:00 is now the event may take until an hour and a half later to get everybody on the course. So those logistics do change. The finish area, again, the ones that have been able to adapt with a larger footprint and space, spread it out, and no touch. Nobody gets a medal put around their neck anymore. That may be gone indefinitely. And the last is the crowd control. What used to be, in many cases, very close crowds that were a big part of the event have been pushed back and spread out to allow the competitors to complete their event and then make the choice of how they want to interact with the crowd when they're done, but not have it right on top of them.
So this sounds like even the bagels and the bananas are going to be spread out more.
Yeah, we've gone through the individual single servings. How are they spread out? The food spread before and post event is not the same anymore. And a lot of it has been recognized as athlete self-reliance. A lot of the luxuries now turn into, how do you manage yourself on a long training episode? Because you're going to need to think about some of those on the event, because you may become your own pack animal,
right,
to avoid some of the issues that are of concern.
Yeah, simple, common sense advice, but things that we need to all take into consideration. And I think these event organizers, they obviously need to hold the events for lots of reasons. And the advice you give is great. I do want to turn to a related issue, because we have you here. You're with the Department of Orthopaedic Surgery, that I think that we heard about elective things and office-based things, and realizing that some of what you do is not so elective and has to be done on a timely basis. Describe for the audience what you and your group went through, particularly early in the pandemic, as things were truly shut down, and what your patients went through.
So early on, particularly with lack of information or lack of understanding about how to safely do things, it was a total shutdown. Surgical cases were put on hold. There were systems of prioritization. Things that couldn't wait, we figured out a way to take care of. Trauma management continued. We actually divided our entire department into isolated teams because we had no idea what might happen. And if one individual became COVID positive, their entire group was considered at risk. So we had to build that out, that if a team went down, we had other teams that could continue care, which worked. Not that we escaped unscathed, but it worked. A lot of what we did very quickly flipped to virtual care. And it was surprising how well both providers and patients adapted to that, to the point that that's still a large component of what we do. You know, we're a very, very large catchment area, and we recognize that some of the care that we traditionally did in person could be done in other manners, and that patients preferred it. It was sometimes interesting to try to evaluate a new patient via a webcam, but if it was that or not come in at all, we did figure out ways to do that. I don't think there's any question that some things got delayed that were harder to dig out of. But as things settled down and we got a better idea, the protocols of how to bring care back safely did evolve. We're back to close to pre-COVID numbers on surgical management, and at or a little beyond COVID numbers as far as office interaction. And that's without even including the telemedicine component. But it has required adaptations, and we have pretty strict protocols to minimize patient risks prior to surgery, and they seem to have worked. Not without some bumps in the road.
Yeah,
but it's worked.
I'm certain. And so, and I imagine, I'll surmise that you and your teams have learned how to evaluate athletes perhaps in some different ways than kind of in the traditional ways. And some of that may actually benefit athletes in their medical and health evaluations in the future.
You know, I think some of it is we've gotten much better at the histories that we ask that I think we may have taken for granted in the past. The hands-on still is big. There's not a substitute for it. It's a little bit of a challenge sometimes. What sounds like something that shouldn't be a big deal, with two parties masked on a sideline, even in a tent, it is hard to get your point across, and you know, you sort of lose the loss of facial expressions is surprising that impacts your ability to assess somebody. But you know, we know almost all of our patients by what their eyes look like, but nothing else at this point.
Yeah, and that I imagine that does have an impact on the sideline. I mean, really,
it does. You don't get some of the nonverbals that you used to rely on. So we have to ask things differently now.
So a lot's changing in the country and in the world, and we see curves that are epidemiologic curves that I think most lay people never thought they'd have to try to interpret, and now they see them every day in the paper. And they look national, but in fact, there are vast differences region to region and city to city. Some of the numbers we're seeing now and what may happen in the coming months. How are you advising event organizers on how to assess their local situation and perhaps change what they do based on what's going on in their communities?
I think there are two parts to it. I think they do need to know what's going on in their community. And you can talk about the current indicators, and those are the ones we see. What's the curve today? I think there are some indicators that give you an idea of where you've been and sort of predict a little bit. So if events can get an idea of hospital admissions and unfortunately death rates, those typically are about 4 weeks off from what was occurring. So if you see those going down, it predicts numbers dropping in your area. The last, quite frankly, is vaccination rates. If vaccination rates can be tracked, and they are, it gives you a prediction of where your community ought to be in 4 to 6 weeks as far as risk. So you look at that whole picture. The other part of that is if you can get that same information from your athlete participant pool. So for a local event, you can kind of say local's local. But as you get into these larger events, you're looking at a pool of participants from a much broader geographic area, and they may present different numbers. So, the questions that have been posed are, what's the risk of the athlete to the community, and what's the risk of the community to the athlete? And you need both of those to sort of decide, are we safe to proceed, with a little bit of a crystal ball part of things. I think the other part that has given people pause recently is, although the numbers have really dropped, what's going on with this plateau? Is this plateau a natural pause because as you vaccinate, as people recover, as we get better at management protocols, you're going to see a rapid drop off? Where do you get to where we're starting to get to what's our new norm versus the concern about variants? And is the plateau because we're waiting for another uptick as opposed to just a normal statistical pause? So, events looking at 6 to 8 weeks from now is where they ought to be looking at some of their predictive modeling.
Important points, and we'll talk just a little bit about vaccines before we close. We've had our recent guest who's really an international vaccine expert, and we delved into vaccines in great specifics between the Moderna and the Pfizer, the Johnson & Johnson, and the various characteristics. And, as physicians, we all strongly encourage vaccination and want to see everybody vaccinated that can possibly be vaccinated,
Yes.
To reach whatever herd immunity comes to be. In the population that you deal with of elite athletes, I'm going to make an assumption that may well not be an accurate assumption, but just for discussion, right now we're focused on people that are at risk, that are either by age at risk or by medical condition at risk. High-level performance athletes tend to be not so much at risk. They're very healthy, and may well perceive that they're not so much at risk from COVID-19. How do we approach a younger, very healthy population and encourage them that vaccination is important for them?
I think there are three components to that. Number one, and I don't think this is something that athletes think about, but certainly for an endurance athlete, there is a period post high-level training or competition where their immune capabilities are compromised. So the ability to train hard is not in and of itself the greatest thing in the world for the immune system. And typically this is not a big deal, but it is now. The second part of this is elite athletes are still part of the general community. And although they may be at somewhat less risk, they're not invincible. And there's certainly young athletes, and there's a subset of people who get quite ill that nobody thinks it should have ever happened to, that we don't understand. And I would not want to see an elite athlete who made a presumption and turn out to be one of the exceptions to the rule. I don't want anybody to get sick, but this would be one of those, nobody saw that coming. My goodness, what happened? And the last part is, as general members of the society, they're still going to interact with other people. How do they want to interact with them? Do they want to be 6 months from now still thinking that their interaction with people needs to be different than the vaccinated population? If we look at the CDC guidelines, they have liberalized what they consider safe interactions, and it's great. I mean, it takes some of the loss of social contact issues and addresses that. But a group of elite athletes training together who are non-vaccinated may become the final at-risk pool.
That's a great set of points, and I hadn't thought of some of that, and I think that's important as we message this to various populations. As we come to a close, are there any major points you'd like to make if you're advising anyone in the sports and entertainment industry, from elite professional level sports to community events? What key messages would you like to leave them with as they approach the next few months?
Know your community. Make sure that you have the resources to get your community specific information, and know the group that you're going to be working with, because they may not be identical. The one last thing I would say, it goes back to vaccination. I would tell an athlete, yes, if you have an opportunity to get vaccinated, please do so. Understand your training protocols are going to change, and if things work well, you will feel bad for a period of time. Build it into your schedule. You might as well go ahead and do it. If the vaccine works the way it's supposed to, with a 2 jab, you're probably not going to feel great. Get ready to wind your training down and then recover from it. But it's that's the one thing I would encourage, that still pursue it and get in line, so that when your number comes up, you get what you need.
Thank you. And thanks, Dr. Miller, for joining us today.
Thank you very much. I really appreciated the opportunity.
Thanks. And thanks for your important contributions. And I also, on behalf of Aveshka and the IIFX, I'd like to thank you for joining us today for this important podcast as we work to educate and bring information to the sports and entertainment industry as we begin to come back together into large and small gatherings all around the country and around the world. In an upcoming podcast, we'll be focusing on other important issues such as testing, logistics, operations, communications around COVID-19. For more information, you can look at www.aveshka.com or at iifx.org to learn more about our organizations. Thank you and stay safe.
Thank you.